When I say phenomenography in 5 minutes-ish. Today, I'm going to give a brief overview of the concept of phenomenography. Now, I must admit that the first time I heard this term, I immediately thought of this. Despite the potential challenges with pronunciation, phenomenography represents a viable option in your qualitative research endeavors. During this introductory video, I will briefly touch on what it is, how it came about, how you might be able to use this method in your research, as well as some of its pros and cons. This research approach is used to examine the differences in the way people, or Muppets, experience, perceive, or interpret a specific phenomenon. In this case, a cute bunny. It is also used to explore how these differences in understanding may be structurally related to one another. It was originally developed to explore learning, particularly that in higher education. This method works well with educational research as it allows you to investigate variations in the learner's experiences and can provide qualitative insights into if and how they gain understanding of a subject. Phenomenography was developed by Martin and Associates at the University of Gothenburg in Sweden in the late 70s or early 80s, depending on who you read. It was developed when the researchers were trying to determine why some people learn better than others. Since that time, it has been expanded to a variety of disciplines such as engineering, computer programming, workplace training and development, environmental assessment, and medical education. Interestingly, the metaphor of deep versus superficial learning that we frequently talk about actually came out of phenomenography. This is reported to have provided the foundation for student-centered teaching and learning, both of which are emphasized in professional education. With regard to the philosophical and theoretical underpinnings, phenomenography falls under the interpretivist paradigm. Ontologically and epistemologically speaking, it is within the subjectivist realm. So what does this mean? Well, simply put, different individuals construct different viewpoints based on their experiences. I promise you there is a method to this madness of phenomenography, and I'm going to take the next minute or so going through the basics of the methodology. Interviewing is the most common method for gathering data. The goal is to capture a wide range of perceptions within a specific group, such as first-year medical students. Interviews are semi-structured, consisting of open-ended questions that are often more abstract and broader in nature, such as, what do you think it means to be a medical student? Or tell me about a recent patient encounter. The researcher must maintain the assumption that they cannot know how a participant will respond or interpret a question until it's been asked. By doing so, it allows for follow-up questions such as asking for clarification, elaboration, or other probing questions. Additionally, the researcher must work to detach themselves from their own experiences and relationships with the phenomenon in order to focus on the participants' experiences. The data are interpreted as individual interviews and then within the context of all interviews. Ideally, multiple researchers are involved in data analysis to prevent bias as much as possible from clouding the experiences of the participants, as well as to help identify categories and any relationships among those categories. As with many qualitative methods, this is an iterative process. Data analysis generally occurs using the 7 steps you see here, which were proposed by Dahlgren, one of the creators of phenomenography at the University of Gothenburg. When reviewing the quality of phenomenographic research, one should consider if each of the categories presented is important in relation to the phenomenon, if the categories themselves are logically related, and that the variation within the data is represented by as few categories as possible. As you've probably surmised, phenomenography allows for depth and exploration of phenomenon and the nuances associated with individual perceptions. This allows researchers to have both depth and breadth of understanding of the topic in that setting. Because of this, it is highly specific to the situation, and it allows you to use as much smaller sample size potentially saving time and money. That being said, as with much of qualitative data, it is not highly generalizable or easily replicated. And perhaps the biggest risk of any research method is the introduction of bias. In this case, it is difficult to remove one's own experiences of a phenomenon when collecting and analyzing data. So, what have we talked about today? Well, phenomenography is a qualitative research method that can be used in healthcare to explore perceptions of learners relating to a specific phenomenon. This data can then be used to inform thoughtful curriculum development. This curriculum can be for patients, students, residents, peers, or some other group entirely. It allows for in-depth exploration of perceptions, and it is iterative in nature. Like any study, researchers must be vigilant in avoiding introducing their own biases to the data. Overall, this is an effective method to evaluate your learners and inform your teaching process. Stick around if you want to take a look at the resources that I used. Thank you for your time, and happy qualitative researching.
That was a great number. I don't care what you say.
I thought it was dumb.
Maybe you're right.